latest breakthrough in green technology to the discovery of humanity's oldest tools. You'll find it all on the Academic Minute.
Listen every weekday afternoon during the KSJE Evening News at 5:30. KSJE is supported by San Juan Regional Medical Center, here for you, providing safe, quality care. Stay informed on the COVID-19 developments to protect yourself and your loved ones at sanjuanregional.com or the COVID-19 information line at 505-516-0938 or 888-949-5387. San Juan Regional Medical Center, caring for the Four Corners since 1910. Eleven minutes past 8 o'clock. It is Thursday morning, April 23rd. Good morning, everybody. I'm Scott Micklin. Thank you for tuning in to KSJE 90.9 FM over the air here in San Juan County, 103.3 FM over the air in Durango, Colorado, and everywhere streaming from our website, ksje.com. Special good morning also to our viewers who are watching the KSJE visual radio program this morning on our Facebook page and YouTube channel. We're glad that you're with us, everybody. Coming up in the next few minutes, my guest today from the San Juan County Partnership. We're going to be talking a little bit about the problem of opioid addiction in our state and in our region. That and more coming up in the next few moments, so hopefully you will stay tuned and join us for that conversation. And then, of course, don't forget at 9 a.m., it is our local information program about the coronavirus. We are sharing it every Monday through Thursday with local information. Megan Cullip is joining me at 9. We'll be streaming that show live on YouTube and Facebook. We hope you'll join us. Today we're going to be joined by some pediatricians to talk about COVID-19 and children. And then we'll also be talking to a gentleman who's coming up with a way to maybe brighten the lives of some of our residents who are living in assisted living and nursing homes. So we'll talk with him about that plan coming up today at 9 a.m. on the show. So we hope you'll join us for that. Mick Hess on the radio side at 9 is going to take us roving with the arts. It's a musical tour today of Spain. So join us for that on the radio at 9:06 on KSJE. And again, if you don't hear us at 9 a.m. in the morning for coronavirus information, we always replay that at 5:06 on the radio, and you can check that out at 5:06 on KSJE 90.9, 103.3, and again on our website, ksje.com. In addition, of course, we also invite you to connect with us on Twitter and follow KSJE on Instagram as well. Let's take a look at the weather forecast as we get going this morning. It's going to be another sunny day, but windy again this afternoon. Those winds could kick up to 40 miles per hour. We could see some gusts. 70 for a high in Farmington today, 43 overnight. It'll be sunny and 68 on Friday, 73 on Saturday, and how about 81 with partly sunny skies on Sunday. Mid-80s on Monday, again in the 80s next week, all of next week, with a high of maybe 88 by next Thursday. So I guess we're going to bump right into summer and skip spring altogether. But let me introduce my guests who are here with me this morning to talk a little bit about the opioid problem in our state. From the San Juan County Partnership, Amanda Evans is back with me in our studio. Good morning.
Good morning.
Good to have you here.
Good to be here.
Thank you for coming back in.
Yes.
It's great to see another person.
Yes, it
right?
is.
So I'm glad that you are here. So there you go. And also joining us via Zoom this morning from Las Cruces is Athena Huckaby is here. Good morning, Athena. Can you hear us all right?
Good morning. I can hear you fine. Can you hear me?
We sure can. Thank you for being here. And Athena, you work for Ideal Option, and that is an organization, and you're based in Las Cruces, but you are kind of expanding throughout the state, correct?
Yes, our first location has opened in Las Cruces. We have locations in 9 states, but we've just entered New Mexico.
Gotcha. Well, great. Well, we're glad you're with us as well, so thank you very much. And stand by. I'll be coming back to ask you a couple questions about the program that you are doing for opioid addiction in our state. But Amanda Evans, let me start with you about the partnership's involvement with this. I know we've talked before about the problem of opioid addiction in our community and what's being done to try to help people through that, because it can be really difficult to break that addiction, right?
Right. It's definitely a problem. People, it's really hard because, you think prescription drugs are safe, and so you start taking them, and then you might have issues with them, or, there's just a lot of different ways that people can start misusing them. And so we look at ways to address that. And it's also not just the misuse, but also the overdoses that can happen. We want to try to prevent those. So we started a group a couple of years ago now, almost two, with community members, different experts from the area, treatment, emergency room doctors, all the different people on different facets of seeing these issues and trying to make some difference in it.
Right, but still a big problem in our state, correct? We still
Yes.
see a lot of these cases, a lot of these issues for people. And so you've reached out to Athena and her organization then?
Well, actually, she reached out to us because they are looking at setting up a Farmington location, and she wanted to make some connections here. And we were happy to welcome her into the group and hear more about her program.
Okay, well, that's a great segue into Athena and bringing her back into the interview here this morning. Athena Huckaby, talk to us a little bit about then reaching out to the San Juan County Partnership and your plans to maybe move into this community.
Yeah, absolutely. So here in Las Cruces, I've participated for a long time in our opioid committee, which is called the Opioid 360 Committee, and is a subsidiary of our health council. So, as Amanda mentioned, this is opioid substance use and substance misuse and overdose death is a problem all throughout the state of New Mexico, whatever region you're in.
Sure.
So I think we're all working on this issue. So I always know that it's a great idea to get connected with the people that are doing the work on the ground, and Amanda and the partnership are really doing that work. So I definitely wanted to connect with them to get informed about what the issue looks like in Farmington specifically, who's working on the issue, and just know more about the local information and local data.
Right, understood. And so now that you've kind of touched base with Amanda Evans and the San Juan County Partnership, what have you learned about Farmington and San Juan County? Are we that much different than the situation maybe there in Las Cruces or in other parts of the state, or do we have some similarities?
I think there are differences and similarities everywhere we go. So with Farmington being in a more rural area than Las Cruces, there's our usual issues we have all around the state with transportation being an issue for people to be able to get to treatment. There's issues with not enough resources to help to combat this problem. I think we see that all throughout the state. Even in well-resourced areas like Santa Fe, the resources still are not plentiful enough, to meet the degree of the problem. So something I've heard said over and over when I consult with people working on this issue all over the state is that we could throw a ton of resources at it everywhere and it just wouldn't really be enough. So
it's that big of a problem.
It really is. New Mexico was number 2 in overdose deaths for many, many years. We're now number 17, which is great news, but unfortunately it's not really because our numbers are better. It's because the problem got so much worse everywhere else that we look better in comparison.
Oh, okay. Well, that certainly puts it into perspective, and not in a good way. But thank you for that, because that is interesting. And Amanda Evans, you and I have talked a lot about the problem of transportation and things like that from our other interviews about the Community Health Improvement Council, CHIC. And so that doesn't come as a surprise to those of us that have been listening to us talk about some of these other issues in our community, right?
No, that's always been an issue here. As long as I've been with the Health Council and with the partnership, we've been discussing, a lot of times we have such a large county and so much land mass and so much spread out of, from Shiprock to Farmington. If there's resources in Farmington, how are people that might need it from Aztec or Bloomfield even getting here? So yeah, we're always looking at how we can make a difference there and get people to the services that they need. Right.
But Athena Huckaby, I understand that your organization offers remote sessions, and folks can connect through their technology, I guess, nowadays. And of course, we're not going anywhere these days, so that kind of makes sense, right?
Yes, so what we've done to try to meet this need, our only physical location currently is in Las Cruces, though we are going to be opening in Farmington, we hope before the end of June, with a physical location
I
on
see.
San Juan Boulevard. But in the meantime, what we have available is a virtual clinic, and it's open from 7 a.m. to 7 p.m. People can be seen by a provider licensed in the state of New Mexico for medication for any substance use disorder. And they can do that either by going to our website, which is idealoption.com/virtual.
Is it, I'm sorry to interrupt, is it .com or .org?
I think either one works.
Oh, okay.
I believe idealoption.com/virtual
Okay.
is the best one to go to. They can also call us at 575-567-3026. We pride ourselves on not running a wait list, being low barrier, taking Medicaid and all other private insurances, and just basically trying to make it as easy as possible for people to see a provider and get some treatment right away.
And folks can do that on their own? Do they need any kind of a referral, or how does that work?
They don't need a referral. They can just call us directly. However, we really love to partner with healthcare professionals in the community. And so if, behavioral health providers or someone from the partnership or the emergency room or anywhere else would like to refer us a patient, they can call our 24-hour referral line, which is 1-844-GO-IDEAL.
Okay, very good. And Amanda Evans, again, having another service provider in the area has to be a good thing, right? Providing some of these other services, even if it's remotely for now, but in person maybe in June?
Yes, any help we can get here is always great. I mean, we're never going to turn down resources that want to come into the community.
Right. And as Athena was mentioning, we have a lack of those around our state, it sounds like.
We do. We've always had, kind of a shortage of physicians in different fields. And behavioral health is always one that's lacking here. So looking at all the different, we talk about opioids, but really a lot of these times the misuse is multiple things at once. So it might be alcohol and prescription drugs, or it might be marijuana, or meth is big here in San Juan County. So, a lot of times we're looking at multiple substances that they might be using, as well as probably having some other issues that they might need to be addressing. So any providers that we can get in and come in and help our community is great.
And Athena Huckaby, can you help with some of these multiple issues that Amanda is describing? It doesn't just have to be opioids, does it?
Right. We can help with alcohol use disorder. There are medications that can help with that, such as naltrexone and the newer long-acting naltrexone shot called Vivitrol, which we also offer. So there are some medications available for alcohol, definitely medications available for opiates. Meth, as we all know, is a little harder, and so we're looking at different things, and there's, research and pilot projects going on around this all the time, but we haven't really found a magic bullet for that one yet, for sure.
Understood. And of course, we all know that addiction, any type of addiction, is difficult to break and to recover from. And so that just goes without saying with all these things that you're talking about, right? And opioids can be really difficult to break that habit, can't they?
Absolutely. And I would echo what Amanda said, especially around alcohol. We're floored by the numbers of overdose deaths that we have, that are opioid involved. But when we look at alcohol-related death, that dwarfs any other drug really in our community, and I think we don't talk about it enough. It's legal, it's available, but it causes the majority of substance-related deaths in New Mexico.
Right, understood. And let me ask both of you, with what's been going on here in the world, of course, with this current pandemic and everyone staying at home, and if you're already addicted or maybe addicted to something, are you concerned, either one of you, that this is going to be even cause worse problems a month from now, perhaps? Amanda Evans, what do you think from the partnership's perspective?
Well, I know I haven't heard official numbers. I have heard a few floated around in some meetings that, we're seeing a huge spike in, we have less liquor stores open, stores where people can buy alcohol, but we have a lot higher sales right now. So we know people are getting it. And then what I've also heard is that we're having issues with people who can't get, maybe if it's not alcohol, it might be another drug that because they're staying home, they might not have access to. So, people are talking about dealing with the withdrawals and things like that while they're home, and then what's going to happen when they can get back out and get these drugs that they've been addicted to before if they haven't gotten help. So I think we're looking at a lot of different issues. We've talked about, with the funding that people are, their jobs might be cut, so that might lead to more drinking or not being able to have access to it. So again, you're dealing with withdrawal. So there's just so many different aspects that I think we're going to be talking about. We're actually right now through our group working on, we're calling it kind of a needs assessment, where we're going to be talking with different aspects in the community. Like I said, the EMS, the hospital, different providers and things like that, and looking at what trends they're seeing, what has changed in the last few months, and what they think their resources they're going to need going forward.
Interesting. Athena Huckaby, same question for you a little bit about what we're looking at maybe down the road with some of these really stressful situations that families are finding themselves in. If there's suddenly a loss of income, maybe the breadwinner has lost their job or they're been furloughed, and if they were maybe somewhat addicted before, this could maybe be the push they need to just go over the edge a little bit, or what are you hearing?
Well, so two things. First of all, I think it's important, like Amanda said, when we do things like decide liquor stores are non-essential and close them, it makes people who are in a substance use disorder, it makes it more difficult for them to get that alcohol, which people think would be a good thing, but alcohol withdrawal can be deadly. And our emergency rooms and, healthcare providers are already overtaxed. So we don't want people going through alcohol withdrawal showing up at our emergency rooms, right? This is like kind of not the time for that. So right. That's just something to keep in mind. I don't, from a public health perspective, closing liquor establishments isn't necessarily a good idea during this time.
Interesting. Okay, right. I follow you.
And then the second thing that I've heard, yes, echoes exactly what Amanda has said, that COVID-19 is impacting drug supply chains. There was a really interesting article in Vice about how the wholesale price of methamphetamine has jumped. So drugs are getting more expensive and more difficult to get. And, when things go back to normal, we might see a spike in overdoses. And I actually spoke with an emergency room physician that sits on the governor's advisory council for opioids who echoed, this concern. So I think emergency room docs all over the state are sort of, seeing that as an issue and thinking about things going back to normal might, not be so good when we're looking at overdose deaths.
Right, which I guess is then another reason why folks should be reaching out to maybe thinking about getting treatment or getting into some kind of program, so when that happens, they're maybe a little bit more in control of some of those impulses, I guess.
Yeah, it's a great time to get treatment. And also, one of the nice things about the medications that we offer, like buprenorphine, is that they help with cravings and help with withdrawal. So if people find themselves not able to get the opioids that they need to stay out of withdrawal, they can give us a call and we can make them a lot more comfortable.
Got you. Very good. Amanda Evans, let me turn back to you a little bit about another topic that we often talk about at this time of year that has been a little bit changed because of stay-at-home orders and things like that, and that is the Drug Take-Back Day that happens twice a year, I think, right?
Yes.
And this year, though, it's not happening in the spring because of we're supposed to be staying home, and we are.
Well, and yes, it was supposed to actually be this coming Saturday, I believe. And so we usually have it, and we usually as a community, I should have grabbed the number, but we usually collect hundreds of pounds, of drugs. And so it's really a time where people can get them out of their house easily. We do have our permanent take-back locations, so we have some at the different local police departments you can still go to, IHS, places like that. But, a lot of people aren't wanting to get out and go to those locations and get out of course, because they're supposed to be staying home, but they also, you might have family members at home, kids at home, that you need to be careful with what medications you have and what they have access to, because you definitely don't want to end up with kids taking something they shouldn't be.
Right. And if somebody has a problem, then there you go. They have access to these opioids or other medications, right? And that doesn't help with that problem. So there's another maybe conversation about how to get rid of some of these things or how to dispose of them more safely if folks can still do it from home.
Right, and one of the projects we're working on is we're going to be working with the senior centers through their meal distribution that they're doing right now. There's little bags, pouches, so to speak, that are from a company called doTERRA, and you can all you do is you put your medications in there, and you can put warm water, close it up, and you can throw it away then, because it kind of makes the medications to where it's not going to, go into the landfill and be harmful or things like that. So it neutralizes them.
That'd be one way to do it.
Yes.
Okay, good to know. But folks, again, this time of year, as we say, should maybe look around their house, do an inventory, look for that either drugs that they're not using, those unused drugs, or expired drugs that are still sitting around. And that's the stuff we're talking about to get rid of. Yeah,
if you've got leftover pain medication, you had a dentist appointment and they gave you, even just a few pills, you don't want them just sitting in your house. It's not safe. They're not going to work, a few years from now. You don't need to keep them around. If you have another procedure, you can work with your doctor on whether you need them again or not.
Well, especially if they're expired, because that active ingredient's no longer probably active.
Right. Right.
I'm not a pharmacist, but even I know that.
Right. But people just kind of keep these things in their medicine cabinet for years. And so, but they can still be harmful. They can be harmful to pets. They can be harmful to children or people who are looking to misuse them. If you have, a family member that's trying to get high, that may be, or has a substance misuse kind of issue, they may be looking for something.
Right. Athena, Huckaby, let me bring you back into the conversation too, because this is a big problem, I know, for folks in your business, right? Because if folks are addicted, they will get these things wherever they can. If it means rifling through grandma's medicine cabinet, they may do that.
Yeah, and people will go to many lengths, to avoid withdrawal symptoms. Opiate withdrawal is not comfortable, right? And people, when you're what we call, addicted, meaning that you're dependent on the opioid, not having it makes you feel very sick, like a really bad flu, body aches and GI symptoms. And, we don't like to talk about it too much because it's very, it's very uncomfortable.
Yes.
So, people will do whatever they can to stay out of that. Absolutely.
And so again, events like this drug take back day, again, always good to just go through the house and figure out what's no longer worth keeping around and getting it either bagged up, as you said, to dispose of safely, or dropping it off at those collection points, which again, I think every law enforcement agency has those in the county.
There's quite a few, and if you actually go to the partnership's website, sjcpartnership.org, we have a page on there under prescription drugs where it gives you a guidebook. It tells you some options. If you can't get one of the doTERRA bags, there's some other options with putting them in coffee grounds, some things like that you can do to still safely get rid of them. And again, it lists all the take-back locations that we have, and hopefully we will be able to have the take-back day in the fall, because they try to do them, like you said, twice a year.
Right.
So, we really just want people to be safe and know what's in their medicine cabinet. If there are drugs that you're keeping, they're not expired, but you use them, make sure they're locked up so your kids can't get them. So that make sure you know where they are. Some of the guidebook recommendations are, make sure you have a list of what you have, so if something's missing, especially for our older people in the community that might not always keep track of everything. They might be taking multiple medications and things like that. So there's quite a few tips and things you can do. Another thing, if you are someone who uses an opiate all the time, and has a prescription and it's in your home a lot, you might want to, doctors now are prescribing what's called Narcan, and that's something that, if your kids or a pet or just a family member or yourself takes too much, you forget and you accidentally take 2 doses or more or something like that, it can bring you back from an overdose. You still want to call 911 always,
Yes.
but it can help save a life if somebody is overdosing. And so that's something we really recommend talking to your doctor about, because now there's a statewide law where doctors, if you prescribe over a certain number of pills, they have to prescribe it, but they don't always explain to patients what it is or how it works. So talk to your doctor, ask questions, ask your pharmacist. Most of them are willing to, tell you what it is and help explain how to use it. You want to, explain to your family members, because you're not going to give it to yourself if you do overdose. So you want to make sure people who are going to maybe find you or live with you know how to use it and what it is for.
Right. Good advice. And I know that some folks even will go to the trouble of counting the pills that they have or figuring out when they're going to run out. And, and again, if you run out a week early, somebody maybe took those pills or something happened to them. They didn't just disappear. So that
Right.
would let you know something's going on.
Right. And
I suppose.
Yeah, that's another thing. I believe our guidebook has like a form on the back maybe that has where you can keep track of all, it lists what medications you're taking, how many you should have, things like that.
Okay. Very good. And Athena Huckaby, let me turn to you a little bit about the issue of coming back from an addiction. And, of course, it can take a long time, and we're in kind of an immediate gratification society these days when everyone just yells at their microwave to cook things faster. But this can take a long time, right, to break some of these very serious addictions that folks come to you with, right?
Yeah, absolutely. It can take, we know, sometimes up to two years for the brain to normalize after something like this happens. I think that's really important to know that substance use disorders are chronic conditions. It doesn't just go away when somebody stops using for a brief period of time. I think people sort of breathe a sigh of relief when somebody has quit for a week or 2 weeks or a month. And not that that's not something to celebrate, but the brain needs a lot longer time than that to heal up and get away from that obsession and compulsion around that substance.
Right. And many times it's got to be more of almost a lifestyle change too, doesn't it? Or even, changing who you're hanging out with, because if you're hanging out with folks who aren't getting clean and getting better, that's going to drag you back into it potentially, isn't it?
Yeah, people, places, and things can be real serious triggers for people, and it's often recommended that people avoid, that they change the people, places, and things in their lives to build new healthy habits, new healthy friendships, healthy support networks, all that good stuff.
Gotcha. Well, this has been a very fascinating conversation to me. We just have a couple minutes remaining this morning. Again, my guest this morning, Amanda Evans, is here from the San Juan County Partnership. Athena Huckaby is joining us. She is with Ideal Option. They are based in Las Cruces in our state for now, but they are looking at expanding into the San Juan County area, and they're now doing remote visits. And so, Athena Huckaby, can I ask you again to repeat some of the phone numbers and website and information about maybe reaching out if folks are maybe in the situation and looking for assistance to stop their addiction?
Absolutely. So people that are comfortable with using technology can definitely just go straight to our website at idealoption.com/virtual. And from there can get put into the virtual queue and talk right with a provider very quickly. If people are less comfortable and need a little help, they can call our call center to schedule an appointment, and they can help them a little bit with the technology. And that phone number is 575-567-3026. And then for our folks working in the community, our health providers, our behavioral health providers, our fire department, law enforcement, if they want to refer a patient to us, they can call us 24 hours a day at our patient referral line, which is 844-GO-IDEAL.
Very good. Well, thank you very much, and thank you for joining us this morning with this information. Very helpful.
Absolutely. Thank you very much to Amanda and the partnership for inviting me. It's been really rewarding participating with that, and I hope to continue.
Very good. Well, we'll talk to you again soon, I am sure. Amanda Evans, let me talk to you as well a little bit as we wrap up today. Again, the San Juan County Partnership, this is what you all do, is look for ways to help our community and break some of these addictions and break some of these patterns, correct?
Right. We want to make a difference. We want to definitely lower the misuse numbers. We want to lower the overdose numbers. We want to make these options. We want to make sure that ideal option is the knowledge of them is out there. That's we're working on updating our family and youth resource guide right now, so that'll be new and updated hopefully in the next couple months, so that the programs that people need access to, they can find them easily.
Very good. And so again, the website, if folks would like to go and check out kind of what we've been talking about this morning, some of those drug take-back permanent locations that are around the community, if they want to go through and I mean, we're staying at home. We have lots of time to do these things, so there's really not a lot of excuses not to go through and get rid of some of these expired or unused prescription drugs. They can go to the website, and that is again?
sjcpartnership.org.
Very good. Thanks for coming in. Always great to talk to you.
Thanks for having me.
You're welcome. Amanda Evans, my guest here. And again, Athena Huckaby, thank you very much. My guest here on KSJE. Everybody, back with more in just a moment. The time right now is 8:39. KSJE is supported by the University of Denver Graduate School of Social Work Four Corners program. They're proud to offer a Master's of Social Work degree in the Four Corners community. Applications for the 2020-2022 cohort is now open. Classes are taught Fridays and Saturdays in Durango, Colorado. Find out more at 970-247-9773 or at du.edu/socialwork/fourcorners.